Surgeons preparing for the oral board exam, you need to avoid the 12 surefire behaviors that will cause you to fail your exam. The first is arrogance. I've seen hundreds of examples of arrogance by candidates during the exam. Arrogance by the candidate toward the examiner most typically occurs when the candidate clearly knows more about the subject of a scenario than the examiner. In fact, it's a remarkably common occurrence that the examiner knows less than the candidate in certain topics. And believe it or not, this situation puts most candidates at a disadvantage because the candidate does not know how to manage that moment. Arrogant behavior by a candidate is almost always inadvertent and non-deliberate and is caused by the stress response to the exam environment activating the individual's amygdala. Under this stress, the candidate is annoyed by the examiner's lack of familiarity with the topic of the scenario. And the candidate typically expresses that annoyance with signals of communication like specific words, facial expressions, and tone of voice that are condescending and patronize the examiner. If the examiner senses such arrogance, which is often associated with disrespect and anger, the candidate will always be failed on that part of the scenario, if not the entire room or even the exam. Granted, there can be a fine line between arrogance and confidence, but in the board exam, the difference between these two is typically quite clear. Avoiding the dozen surefire ways to fail the surgery oral boards can be done with proper preparation under experienced guidance. Give me a call with any questions. I'll be happy to answer them.